Imagine this. You go to your doctor and you leave with a prescription, but it's not for a pill. It's not for an injection. Your doctor has prescribed light. It kind of goes against everything we think we know about medicine, right? So what is going on here?
I mean, seriously, why would a doctor prescribe something that we get for free every single day? Is this just some kind of placebo effect, or is there a deep biological reason that light can actually be a powerful form of medicine? Well, that's the central mystery we're going to unravel today.
So to get to the bottom of this, we have to start with what we can call the winter enigma. Just think about animals for a second. When winter comes and the days get shorter, it causes these massive changes, right? Groundhogs hibernate, weasels turn white, birds stop singing. Well, it turns out the changing seasons can trigger a similar and clinically significant response in some of us humans, too.
Now, let's be clear. A lot of us might feel a little sluggish or maybe a bit down during the winter. We call that the winter blues. But seasonal affective disorder, or SAD for short, is a completely different beast. We are talking about a debilitating condition here, something that can severely impact a person's ability to just function.
And this isn't some super rare, obscure thing. Researchers actually estimate that around 1% of the entire global population experiences SAD. That's tens of millions of people whose lives are profoundly affected by the changing of the seasons, year after year.
And when we talk about symptoms, this is where it gets really serious, because they largely overlap with what we see in non-seasonal depression. We're talking about pervasive feelings of sadness, a total loss of interest in things you used to love, this unshakable fatigue, and even big changes in sleep and weight, and in severe cases, suicidal thoughts. This is exactly why it's not just the winter blues. It's a serious medical condition that absolutely needs professional attention.
So what on earth could be causing this profound seasonal shift in mood? Well, scientists have a prime suspect, our internal biological clock. It's this incredibly complex system that's deeply, deeply connected to light.
And how this works is actually pretty cool. So first, sunlight hits these special light-sensitive cells in the back of your eye, in your retina. Second, a signal zips down your optic nerve. And third, that signal arrives at this tiny part of the brain called the suprachiasmatic nucleus. That tiny spot, no bigger than a grain of rice, is basically the master conductor of your body's internal orchestra.
This clock, this conductor, is in charge of regulating our circadian rhythms. These are the daily 24-hour cycles that control literally everything, from when we feel alert, to our body temperature, to our hormone production. And, just like with an orchestra, if one section is out of tune, the whole performance can just fall apart.
So, when it comes to what's going wrong in people with SAD, scientists have basically narrowed it down to two main theories. Theory one is a melatonin overdrive. That's the sleep hormone, which kind of keeps the brain in this state of perpetual twilight. And theory two is a shifted clock, where your whole biological clock is basically jet-lagged and running out of sync with the actual time of day.
I love this quote because it just perfectly sums up that second theory. Essentially, their hormones are telling them that it's still nighttime. It's like your body is stuck in a different time zone, even though you haven't left your house. And that internal disconnect is what can lead to that profound fatigue and the real difficulty waking up that so many people with SAD experience.
But of course, it's never that simple, is it? Biology is a huge piece of this puzzle, for sure, but it's not the whole story. The mystery of SAD is way more complex, and to really solve it, we need to look beyond just the body's internal clock.
It turns out researchers believe a bunch of other factors contribute. Psychology, for one. People with SAD are more prone to repetitive negative thinking. Genetics are also involved, which is why you sometimes see it run in families. And this one is fascinating. Culture might even play a role. Some experts think that cultures that really embrace winter, with festivals and social activities, might actually provide a protective buffer against the isolating effects of the season.
And just when you think you're getting a handle on this whole winter thing, the science throws us another curveball. Some people experience the exact opposite, summertime depression. It might be triggered by too much light, or heat, or humidity. It's just a reminder that when it comes to the really intricate dance between our environment and our mood, we're still just beginning to understand the steps.
So, let's circle back. We've talked about our internal clocks, we've talked about hormones, and all the clues keep pointing back to one thing: light. And this is exactly where that strange prescription for light comes back into the picture. The primary treatment is called light therapy. It's a non-invasive, evidence-based treatment that's been shown to be really effective for a lot of people with SAD, and it's designed to do one specific thing: help reset that master biological clock we were talking about earlier. So what does this actually look like?
Well, a patient will typically spend 30 minutes or more each morning sitting in front of a special device that emits full-spectrum light. You can think of it as a daily dose of artificial sunshine designed to give your brain the light cues it's missing and shift those circadian rhythms back to where they'd be in the summer.
But, and this is really, really important, it's not as simple as just buying a bright lamp. Light therapy should always be started under the guidance of a healthcare expert. This isn't just about making your room brighter, it's a targeted medical intervention, and it requires professional oversight to be both safe and effective.
And that brings us to the big takeaway here. The fact that something as fundamental as light can so profoundly affect our brains is just incredible. It leaves us with a much bigger question. If light has this kind of power, what other elements of our daily environment are quietly shaping who we are and how we feel? The story of SAD is this powerful reminder that we are all deeply connected to the natural world around us, and that sometimes the most effective medicine isn't found in a pill at all, but in the light that surrounds us every day.